Thanks for staying with us and welcome to the Twitter Jabs. My name is Agi Uwase and we are continuing the conversation in regard to the Ebola outbreak in Uganda that was discovered in Museveni district last week, and definitely the first case or the first person who passed on was a 24-year-old male. And as we speak at the moment, there are about 5 deaths that have been confirmed and other suspected cases. So joining me to give us more insight in regard to how the country or the Ministry of Health is managing the Ebola outbreak in Uganda are 2 gentlemen. One of them is Dr. Samuel Oledo and is the president of Uganda Medical Association, as well as Dr. Musa Lumumba, who is the president of the Federation for Uganda Medical Interns. Good morning, gentlemen, and thanks for joining us.
Good morning. Thank you so
So
much.
to start with, how is Uganda or the Ministry of Health handling the Ebola outbreak in Uganda?
Yeah, thank you so much, and good morning, viewers. I believe that question is best answered by Minister of Health. But as of yesterday and of today, we are grateful that the different engagements of Uganda Medical Association, Ministry of Health, and also WHO with other stakeholders is yielding fruits, because as Uganda Medical Association, we have a mandate. Our mandate is basically the welfare of doctors, patient care through professionalism, and improvement of working conditions, which is key. And we are honored that yesterday we got good reports about our dear colleagues who are basically under hospital care, the 6 health workers, including the medical intern, medical student, and then the senior house officers.
Yes.
With an anesthetist. We are glad that they were separated from the treatment center and from the mix of other patients, because that is key. And they were taken to another facility for better care and better monitoring.
Yes.
Because we have what we call PTSD, and also the trauma that comes with it. That you've been caring for these patients, and at the same time you're being cared for amongst them. That is a bonus.
Yes. Now, before I get to Mr. Musa, what is your take as the president of Uganda Medical Association? How do you think they are handling this Ebola outbreak?
Ministry of Health is doing its best now, but to be realistic and sincere, the resources are very meager. You know, we need to come into reality. I love the president's address yesterday. It was straight on some areas. For example, the areas of PPEs, straight on. Don't touch a patient without PPEs. Much as it was reduced to, you don't have to touch a patient without gloves, which is good. The spirit itself that comes with is a spirit of concern. The president was speaking as a parent, so concerned that we need not to lose any other person. Because if we are coming from a history of 64 health workers who have died due to COVID-19. That's the history we're coming from. And now we are getting into a more deadly and infectious disease. The beauty with Ebola is that it gives the infection contact, it gives that room of less infectiability basing on the contacts, other than COVID-19, which can easily spread so fast. But the only disadvantage with it is very catastrophic when you get it, because the mortality rate right now stands at 65%. Okay, that is not so nice. But in the same spirit, we are also glad that the president realized that it is high time we mobilize resources towards this.
Yes.
Because it is a key. But our concern is, prior to this, PPEs were not enough, the health workers to begin with. And even now, places which are hotspots like Museveni, you cannot afford to have minimum PPEs at level 1 and level 2. That is at triage and also OPDs. You must have full breast up for these doctors, okay?
Yes.
So that they are protected. Because there are others who are going to show up mimicking other clinical symptoms. The people who died, the index cases who died, one of the cases died having had a surgical condition.
Yes.
You get it? Because he had experienced obstruction of the bowel, what we call the intestines not be able to push food beyond a certain point. okay? And it was a surgical emergency. And actually, the 3 senior house officers who are right now hospitalized are surgery SHOs. So, meaning, if it mimicked other prevailing conditions and ended up causing that, there are great chances. Actually, our statistics tell us there are also children in the early stages, okay, babies who presented with clinical symptoms that mimicked upper respiratory tract infection and GIT problems. It's a reason why actually the medical student who is hospitalized, who was in pediatric ward, is actually infected because the last baby he cared for had this manifestation and passed on. Okay? Now, this gives us an assurance that there's no one who is safe in any department when it comes to the hot spots. There must be PPEs fully braced up.
Yes.
Then other units can basically, like out of the infectious zone, can basically have these minimum PPEs. You can have minimum PPEs, but also make them be prepared. Because we are stopping movement. You get it? So meaning the incubation period given to the virus itself, it gives room for other places to be open. So we are saying let all health facilities be ready. But also the demotivation among health workers.
Yes.
It is what is killing the spirit. Remember, how you handle someone at the time when you need them is quite important, that when you need them next, they'll reflect on how you handled them before.
Yes.
The morale in Naguru, the morale in Mulago, the morale in Entebbe, and any other hospital which handled these cases, because Mulago handled Ebola.
Yes.
The previous outbreak of Ebola, Mulago handled it. And these, we would expect units which actually handled one Ebola to be well braced up for this, but the spirit is low. Units which handled COVID-19 should be well braced up. We can't close out the CTUs and wait for any other outbreak. These places should be left active in preparation for any eventuality. Now we have Ebola. In a scenario where Ebola has hit the whole country, do we have a preparation plan as a whole nation in these units? Have we mobilized resources enough for this? So that's where it is going. Lastly on this, you realize that we lost 64 health workers
in the last
COVID-19. None of them was compensated. You get it? Right now we have critically ill. The 3 SHOs, they're critically ill. The 1 intern, critically ill. Now, these, and today, there are other interns who are showing clinical symptoms. Who are in the Mbende radius? They're showing clinical symptoms. Yes? Joint pains, fever, generalized body weakness. Others are having GIT symptoms.
Yes.
And yes, we agree they should screen all of them. Screen all of them, identify who are negative, give them priority. Even those, because right now others have PTSD, they're traumatized, that the fear of the disease itself might actually cause them to be predisposed. So our humble request in this regard is, if there is an opportunity for some of the interns, okay, who have tested negative, okay, for us to redeploy them elsewhere, it has reduced the congestion. Let's have the most relevant number there. And 2, let's recruit as many professionals as possible. We have 2,000 doctors unemployed on the street. These are qualified and are ready to enter. You get it? Can we massively throw them into those areas as long as they're willing to work? Because they're willing to work. And now you have only 40% staff gap. You have less than 12 medical officers to handle these cases. There's what we call work burnout. People are exhausted. You get it? Now you find someone who has been working on another ward, has been redeployed to Ebola. Now, the other ward, the rest of the people you've left there are actually understaffed. So at the end of the day, we are looking at, can we have massive recruitment of staffs nationwide? Can we have the issue of the compensation for immorbidities and then mortalities thought about? Can we have protection of the health workers and also the issue of facilitating those who are sick? I can assure you, the health workers who are down right now, we are even buying for them the consumables. It is not nice. So how we handle this is the key. And as Uganda Medical Association was saying, we stand with government in this. But in scenarios where it escalates and causes a lot of mortalities among the health workers, I think we shall withdraw so that what we recommend to government is put into consideration.
Well, thank you so much for that submission. Now over to you, Mr. Musa. I would like to know from you, what are some of the challenges that medical interns as well as medical workers are facing in regard to this Ebola outbreak, and also entirely what's your take on how the Ministry of Health or Uganda is handling this Ebola outbreak?
Thank you so much, moderator. First of all, I'm going to applaud the president. Yesterday's presidential address, he paused and talked about gloves.
Yes.
He asked, actually he directed that no one should touch the patient without gloves. The president, not being a doctor, I think he wanted to mean personal protective appliances or equipments, what we are calling PPEs, and that is a positive for everyone. And in that regard, I also remember the Minister of Health making a statement that was reassuring to health workers. And so this talks to what you're asking. What are the challenges that colleagues have been facing at the front line? You might remember that stories were through the media that interns were striking at Museveni General Hospital.
Yes.
To us, they were just crying out for help, crying out loud for help, making sure that whoever is concerned does the right thing. And what were the issues at hand? They were asking for personal protective equipment, which are gloves, aprons, gumboots, gowns. And then lack of supervision. Because what do we see when epidemics and outbreaks come? We see that seniors tend to withdraw because everyone fears. So the young ones who are robust, who have got the energy, we tend to be the ones at the front line, just like in war. You don't expect a general to be at the front line. Yes, the generals will be behind, commanding, but at the front line you have the junior ones who can run and shoot and so on. And so in this aspect, we saw that the first people who responded were the interns. So I must salute our colleagues at Museveni Regional Hospital for having been there to respond to the first cases. Unfortunately, like you've heard from the president, Uganda Medical Association, and of course from the president, one of the people that is right now sick of Ebola is a medical intern. And it came from the fact that when the patient was presented, of course no one knew what they were presenting with, but the condition necessitated that this intern is part of the team that rendered help, medical attention to this person. And in the process, they got exposed because they didn't know. So we must salute colleagues who were on the front line. But so arising from that, interns are striking and what is happening, we had a meeting on 27th with the Director General of Health Services, who is Dr. Henry Mwebesa, together with his team and the leadership of Museveni Regional Hospital and the interns. And what were the issues we discussed about were availability of gloves, including other PPEs, and making sure that everyone who is in Museveni, every medical intern who is in Museveni, is assessed and screened to ensure that they are not positive of Ebola. And those who are found to be Ebola positive to be accorded urgent, specialized care. And we need to also share that indeed colleagues were evacuated from Museveni to Fort Portal Regional Hospital, put into a specialized center that is managing them. However, talking to them this morning, the situation is not good, and some of them are too cold. Fort Portal is too cold, and so they need additional beddings and so on and so forth. As the Federation, we are going to work together with the Ministry to ensure that they get those warmers,
yes,
blankets and jackets and so on and so forth. So, as the leadership of and the representation of our colleagues at the front line, I think the onus is upon us to ensure that our colleagues get what they need at the front line. Get the PPEs to protect them, to reduce the exposure. But of course, having a PPE doesn't mean that you're not going to be exposed. But at least you're reducing on the risk of exposure. But also making sure that they are trained in Ebola prevention and control. Because there is having what to use, but also knowing how to use it. So we want to make sure that our colleagues are trained wherever they are now, not only in Museveni, but across the country. Because we've been hearing news that we might be having a case in Masaka, which Minister of Health has not yet confirmed. You've heard we might be having a case in Kasangati, which results are not yet what. So it means what? And of course, you know, Ugandans, we are moving here. Today you're in Mbende, tomorrow in Mityana, Kampala, Busia. So we want to make sure that everyone, wherever they are trained in Ebola prevention and control techniques, as well are provided with those PPEs. And no one should be tempted. No one should be coerced into attending to any patient without PPEs, because this is what the president said.
Yes, but as we speak now, because it's over a week since they declared the Ebola outbreak in Mubende district, and yesterday I remember Dr. Jen Ruth Acheng reassured the president and the country that actually personal protective gear has already been given to the medical workers in Mubende district, as well as the isolation center. But now looking at what you are saying, because I would imagine that during medical routines every other day, even besides the Ebola outbreak, medical workers and interns should be able to wear gloves as well as masks and the apron. So what have they been using prior to that?
You know, it's so unfortunate that it's during times like these, during outbreaks and epidemics, that we really, that some of the gaps within the healthcare system are found out. I know that are found out, but come to the understanding of the majority of the people in this country. Why should we be discussing gloves right now? Why should the president be emphasizing use of gloves? Why? The question is why. So I think we tend to have a disconnection between what the president knows, what happens at the Ministry of Health, and what exactly happens on ground. Because if we had gloves, the interns of Mubende wouldn't have cried out for help, saying we don't have gloves, we don't have PPEs. We wouldn't have had such a situation. So it means either we're having gloves in Mubende, but they're not accessible. Maybe they're in the stores, or actually the stores don't have these gloves. You get it? So let us not be defensive. I urge everyone who is involved in this, all stakeholders, let us not be defensive. Where we have resources, let us say we have these resources. Where we don't have these resources, let us say we don't have resources. Because like you saw the president say, people should use gloves. So if you don't have resources, I'm very sure the president is willing to ensure that we have the resources to buy the necessary tools that we need at the front line. Otherwise, this defensiveness will not go to help us. It's
I think there's a problem of misinformation.
And like the president, medical association said, we are not willing to have other colleagues of ours get into Ebola treatment units in the name of being tested positive. Because we know what we are dealing with. We are dealing with a condition which has got a case fatality rate of 50 and above percent. In the previous epidemics, it has even went to 90%. We've lost senior colleagues in the health profession, the likes of Dr. Lukuya, the likes of Dr. Kule, and others that were not mentioned. Sometimes when the young ones die, they don't make news. When the big ones die, they make news. So we want to make sure that the young ones, the medical interns, no one, let that remain with whoever is, it's unfortunate that our colleague is now grappling, is dealing with this condition, but we want to make sure that no other medical intern, no other health worker gets exposed unnecessarily without PPEs. Yes,
so I would like to get it from you.
Let me just react a little bit.
Yes, it's okay.
And thank you so much, Dr. Musa, for that. But you know, I love Uganda. Uganda is a beautiful country, and it's a very lovely country. Because we are blessed to have a president who is actually a parent. If you read the facial expression of the president, he's actually concerned. He's concerned and he's putting himself in the shoes of a scientist. And it is important that us, the scientists, help the president to guide him rightly with the rightful information. We don't want to be, now we are the third country which has, according to the rankings, which has had high mortality rates in respect to Ebola. Sierra Leone is leading with DRC. We do not want to overtake these countries. It's the reason why we come back hard. We come hard on these issues. And as you observe all this defensive mechanism, all is well, things are okay, Your Excellency. Things are going well. No, things are not well. Things are not well, we are telling you. I am telling you as of today, medical interns and other colleagues in Mubende are showing clinical symptoms of this. I assure you, these other six health workers who are admitted indicates to you that they have been interacting with these other colleagues. So you have medical school which has been there. You have the nursing school, 3 nursing schools which have been there in the same hospital. Okay? You have a patient who was on a medical ward, a patient who was admitted on surgical ward, every day clocked, assessed. And remember, there are some things you cannot avoid. Like, for example, if you're doing general examination of a patient, someone is getting a stethoscope and is putting it on someone's body. At that time, there was a lot of exposure. Okay? What we should accept right now, Mubende area, especially the hospital area, there's a lot of contamination. We are going to give it 2 weeks. I assure you, you're going to see numbers rise up among health workers. Okay?
Yes.
And it is important for us to have mitigation strategies put in place. Let's have the antiretrovirals available, because statistics indicate and studies show that they can suppress the viral activity. Okay? Let's have the necessary medication available. What we need to procure, which is not available with us out of the country, let's procure this so that we can safeguard not only the health workers, but also the patients themselves. And this is what I'm saying live on camera. Let what we did in COVID-19, where people were mobilizing resources, I would love Minister of Health to be honest on this. Let people mobilize resources for this cause. I assure you, as Uganda Medical Association, we are now in a drive to mobilize resources to help the health workers who are tested positive and are in the treatment center, because they need fluids, they need oral rehydration, they need feeds. These people cannot eat in anything and then it stays in the GIT. It comes out, they vomit it out. So there must be constant taking in fluids through IV and oral fluids and also feeds, because the body needs at least to retain something. Not vomiting throughout and then diarrhea throughout. So we are saying we need extra support. There are companies which do beverages. We need these treatment centers to have a lot of water at all times. We are tired of situation whereby we are shocked that even those who are in the ETU, the medics, in the night they were crying for support. Please throw us water. You find health workers and students are going to buy water in the night to throw water over the fence for these guys to get water, because others would actually die because of dehydration. You get it?
Now
so the situation is not as like it is well, it is okay, it is not.
Let me cut you short, because I don't know if there's a gap in communication between the Uganda Medical Association and then medical workers and the Ministry of Health, because from the first time when the first case was, presented to the Ministry of Health, they went on ground in Mubende district. Even the other day, Dr. Diana Atwine was there. And yesterday, the Minister of Health looked like he was reassuring the president and the country that everything is in place at the moment. So is there a gap in communication between the medical workers and the Ministry of Health? Are there things that you are not telling the Ministry of Health that they need to tackle? Because it looks like, we are getting different stories from both sides.
I wouldn't want to talk on behalf of Minister of Health. I don't want to talk on behalf of the PPS or on behalf of the minister. Yes, we saw it on camera. The minister went to Mubende, you get it? But what we are giving you is the actual situational analysis on ground. We have what we call branch executive committees on ground of Uganda Medical Association. We wouldn't want to pick our dear colleagues here. As Uganda Medical Association, we have had a team, a delegation which has gone there. We want to reduce as many exposures as possible. We wouldn't wish to take the entire team. We have the leadership of Uganda Medical Association has up to about 200 leaders. We wouldn't want to have these leaders at every level be exposed. We have already a team in Mubende and it's giving us this. And also the health workers, all of them. All the doctors are members of Uganda Medical Association. Same applies to the interns. So we have direct contacts of this. So we are concerned, as I told you, the mandate of Uganda Medical Association is simple: the welfare of its members and also professionalism. In all this, I understand where the communication comes from. We really need also a financial liberation at such a time, because the president is looking at two areas. How do we sustain the economy vis-a-vis the disease? Yes, it's true, we can mitigate the disease. The whole Ebola thing, we can mitigate it. But also the economy must revive, which we totally understand. The dishonesty in relationship to how many people have died, how many are sick, and all that. When a president has spoken, you do not want to enter into the president's speech.
Yeah.
You want to observe and obey. But there are areas that we need, as Uganda Medical Association, to come out and highlight, especially the area of patient care, the carers of caregivers, okay, and also the area of avoiding any other eventuality, the massive spread. So why we are talking about this is, you realize that if you go to Museveni Regional Referral Hospital, yes, there is an HDU. Okay, that is the highly dependent unit. Is it well facilitated? Is it well stocked? That in a scenario where, because one of the SHOs actually was on oxygen yesterday for over 12 hours, even up to now, it's still on oxygen, saturating at 60. It's not nice. It's not nice. You get it? Now, the question is, when such cases enter into decompensation and they need ICU management, okay? Right now, the minimum we have is HDU. Have we stocked up the intensive care units? Have we stocked up the highly dependent units enough with consumables? Do we have the anesthesiologists available, emergency physicians, okay? Do we have the emergency team that works in those highly dependent units available? Yet, in COVID-19, we disbanded the entire team. Do we have a strategic plan for critically ill to be managed, or we are looking at mild, moderate? But the severe, do we have the whole structure set up and the necessary supplies to handle this? It is what we have to look at deeper. And for us as Uganda Medical Association, we still insist, and I still insist on this. Parliament has the mandate to allocate resources. This is the time when we need an extra budget, a supplementary budget, specifically for health, to handle those other areas. It is not important to cover up and say everything is well, and then tomorrow it blows up. We do not want to be the leading country in Ebola mortalities. No, we are tired of being up there. Let us also be down somewhere. And that's the word of the president. It's the reason why the president is talking about the issue of the vaccine. Can't we try the Zaire vaccine onto the
Sudan vaccine?
Let's talk about that.
You
Is
get
it
it?
feasible?
You don't want to put a donkey on a cow. But the president is not a scientist, which is understandable. But he's very bright when it comes to issues of mitigating. Okay? It is a very good direction of thought when you talk about bringing it. But you know, these have different pathogenesis. Okay? They have different modalities, okay, of action and then of spread. So you wouldn't want, research is going on. So we are optimistic that probably let this Ebola strain and outbreak in Uganda this time steer up as scientists so that we can have a direct thought and a direct workout on the vaccine. Because last time we used the convalescent plasma of the patients who had suffered from Ebola Zaire variant strain, and then we developed the vaccine out of the convalescent plasma. We hope that that can still be done, okay? So meaning, this now talks about the issue of resources. Because you can't discover a vaccine without resources. So it comes down to what resources do we have available? Do we have the lab set up? Are we going to inject more money specifically for this? It is high time, I think, we inject a lot of resources in this vaccine discovery so that we protect the future generation. That later on in future, even if we have Ebola outbreak anywhere, we are sure we're going to vaccinate all the health workers and the communities. So that let us be the country which has the patent right of discovering the vaccine for Ebola Sudan. Because we are the ones who are hit right now. I think that's where it comes to resource allocation. Let's hit it hard. we shall be a country which is proud to be the first to have such.
Yes. And now, Mr. Musa, given the fact that at the moment 5 deaths have been confirmed and then 24 other cases, I'd like to know what is the survival rate, or because yesterday there was more of an assurance or reassurance that it's not as serious as it may seem, or how the public and the press is putting it out there. That is the picture that I got from the presidential address. So what do you think would be the survival rate at the moment? Do you think we'll be able to curb this Ebola outbreak anytime soon, or we might actually see cases, going up?
During times like these, we need to send a positive, reassuring statement to the population, to Ugandans. But as well, we need to balance it with facts. Ebola is not like malaria. It is a highly contagious illness that kills. But what I see from experience is that as a country, we have experience in dealing with Ebola. Actually, one time you saw that some of our healthcare workers went even to Sierra Leone and DRC to support those countries in dealing with their Ebola outbreaks. So in terms of, do we have the necessary capacity in terms of human resource that is technical enough to deal with this epidemic? Yes, we do. So when do we think we are going to deal with this? No one can predict. Just like for COVID-19, no one predicted when it would end. Yeah, we still have some cases here and there. So as well for Ebola, no one can say we are going to deal with it and end it tomorrow or the other day. But we are hoping that God can help us, can continue to bless us with the knowledge and wisdom to do the right thing. And I think at the moment we are doing the right thing. Healthcare workers are ready, like the president said. We have over 2,000 doctors on the streets, not yet employed. So if we give chance to those to come into the system and contribute to their efforts, I'm very sure we shall have the necessary human resources to do that. But we need to match the human resources now with the financial and these other consumables that go with that. And I must commend the medical interns for being there for the first cases, because they are the first responders. And as you know, no one comes from the community saying, "Oh, I have Ebola." No, they come with signs and symptoms. And when they do come into these hospitals, who are the first people to respond to them? Are the medical interns. So they are the ones to first triage. They are the ones to find out if this patient might be a suspect or may not be a suspect, and then send them to the Ebola treatment units and so on and so forth. So basically, as a country, I believe, and as a young doctor, I believe we have the capacity, given the experiences of Ebola we've dealt with, not only in Uganda, but across the continent. But as well, I know that colleagues are working, doctors are doing the right thing. They are working, they are investing their resources and time. Like he talked about burnout. We are having people having to work sleepless nights. Right now, I'm very sure there are some colleagues in Entebbe, Uganda Virus Research Institute, who are working day and night to ensure that we have a vaccine, just like the president said. They're working towards ensuring that diagnostics are taken nearer to, like you saw, they're looking at deploying two vans in Museveni to ensure that now samples don't have to travel to Entebbe. Samples are collected and then tested in Museveni. So we are doing, but what we are also saying as the leadership of these people on the front line, let them have the technical knowledge and skills, let them be trained, let them be availed with the PPEs, let everyone be involved. Actually, this needs a multi-sectoral approach. You remember when they talked about the health facility, the health center 3 in Museveni that needs a solar-powered borehole.
Yes.
You get it? Solar-powered borehole. It means what? It means there is no running water, but also it means there is no electricity. So should we leave this on the Ministry of Health? No. And the Ministry of Energy should come in and ensure that that health facility and all other health facilities in this country have got power. Then the Ministry of Water should ensure that all these health facilities have got running water. So this is not only Ministry of Health. Everyone should be involved and everyone should play their part. And I think it is now timely for us to ask Parliament to have a special session on Ebola, to bring together all stakeholders, all ministers, to have a ministerial approach, a collective ministerial approach to deal with this epidemic, so that we contain it as soon as possible. Yeah.
And I think at the moment, because with the Ebola outbreak and the Ebola virus, it's a matter of urgency at the moment. So because earlier you mentioned that some medical workers, especially that are on the who are unemployed at the moment, they could be brought in and then trained.
Yes.
So how long would the training take if we are to curb the Ebola outbreak as soon as possible?
We have, of course, Ebola. Like when we go to school, we are taught all of this, including Ebola. However, now we need targeted training, which can take maybe 1 week or 2 weeks. Yeah, targeted polishing of what do we have at the moment, what are we dealing with at the moment, and what can we do, which can take 1 or 2 weeks. You get it? And of course, like I said, we have colleagues who even went to Sierra Leone. We have colleagues who have been to Gulu, to Luero, to Ndibujio, to Kasese, dealing with the same epidemic.
Yes.
So we need those to be mobilized, but as well the young ones, like I said, you don't expect to send a general on the front line. So the seniors have to be out behind, but making sure that the young ones have the necessary tools and resources to deal with what we're dealing with at the moment.
Yes, I think there's also something that got me curious earlier that you mentioned that one of the medical workers who are infected with Ebola were transferred to Fort Portal Regional Referral Hospital.
Yes.
Does that mean that Mubende Regional Referral Hospital is lacking in any way to treat these patients?
I wouldn't wish to speak on behalf of Ministry of Health, but history tells us that Mubende Regional Referral Hospital is a newer site. Fort Portal is a little bit older. So it means what? The facility is a little bit more capacitated than Mubende,
yes,
given the years of experience. But also, there is a specialized medical clinic, medical research clinic within Fort Portal, where colleagues have been evacuated to. So I'm meant to believe, and colleagues have, like I've told you in the morning, I talked to the colleagues who are admitted, and they say the facility is much better than the one in Mubende. The only challenge they're having is that Fort Portal is a little bit colder, and so they need warmers. So we need to get them bed sheets, more blankets, more jackets, so that they are kept warm. So the facility is much better
than the Mubende Regional Referral Hospital. Anyway, as we wind up the conversation, because we are really running out of time, I'd like to get your final remarks in regard to the entire Ebola outbreak and how we are managing or handling it at the moment, or how we should handle.
Yes, thank you so much. Allow me to thank CTV for the great opportunity to really come on air to address these issues. Allow me to say, all doctors, as long as you finish internship and you're working, you're taught into the area of infection prevention and control. All doctors, we are taught every type of disease, tropical diseases, any type of illnesses. So doctors are braced up. So it is easy to get these numbers and then polish up, have them be available. I remember in COVID-19, we had 6 months to train those who are going to work in the HDUs and then ICUs. Emergency cases, okay? But with Ebola, we've had them train not for that kind of period. And most of this is basically infection prevention and control measures. Now, my concern over this is, it is high time we have massive recruitment of health workers into the health system. Let's have them there, okay? And allow me, before I conclude, to also thank the President in one area. The President honored his directive and his discussion with the doctors by increasing the welfare. We are glad that the medical interns, right now, they earn the 2.5 million shillings, but the other 10% tax reduction that he had promised, that the medical intern is able to stay in a comfortable place, able to access the necessary resources, and also be adjuted in the rightful time. That 10% tax reduction from the 30% is key. It can help them to rise up. Two, the health workers, cross-board, the increment was great, and we thank him for that. However, there's a category which was negated. The specialists, who are very key, who supervise the interns, who oversee departments. Those are medical officer special grade. Probably they were alienated by the name medical officer special grade. They could have thought that this is another category of medical officers whom we've already given 5 million shillings, so we should give them 6.2 billion shillings. After all, they're also medical officers. No, they are not. These are specialists These are people who have the second degree. They've gone back for specialization. And the agreement was 10 million shillings so that we can attract them. We don't want the brain drain, okay? Kenya has over 60 specialists who are Ugandans. You go to Botswana, same. Tanzania, people are getting out. The biggest challenge with specialists, they will not have the mandate to fight back. They will look at what are the best alternative places. Kenyatta University has advertised over 50 positions for specialists. So we don't want to lose our cream de la cream, who are in the regional referral hospitals, who are in the general hospitals, and also national hospitals. Okay? So now, we are saying, let that be put in the budget of 2022-2023. Let them be enhanced to the 10 million which was planned for. And also, there's a lot of stagnation. So you find that these specialists on finishing, others are still employed as medical officers. Can you believe that? So you finish and you go and work back in the same position you are in as a medical officer. There's no gap of promotion. There's no gap of deployment. If I've worked as a medical officer special grade specialist for more than 3 years, I'm entitled to become a consultant. Let's have these promotional ranks, just like in the army. If you've gone for specific training, you're promoted. So this will encourage us to have a resilient team that is well equipped, that in case of an outbreak like this, in case of challenging moments in health, we have the staffs, we have cream de la cream, starting from up there to the lowest. They're available, motivated, and on point. My last issue is about the facility we're dealing with. Briefly. We need to help Museveni Regional Referral Hospital. If you see the isolation area where patients are being isolated, you find even there's no power, okay? They're sleeping in a tent. Imagine a sick person being thrown into a tent. It is not nice. These who are contacts, for example, you transport 9 in an ambulance, okay? The contacts, and you after testing the 9 of them, you realize that 6 are positive of Ebola. The other 3 already are predisposed because they were in the same environment with these ones. Same ambulance behind, you get it. Now you put them in monitoring, you're overseeing them. Yes, you give them food, which is okay, but you're putting them in the cold, okay, observing them. People naturally, they get fed up. They ask themselves, it's like you, I put you in a tent, and I'm not giving you any medication. I'm not talking to you. I'm saying, let me observe you.
And then you have fever.
Yeah, you get it. It is catastrophic because even me, I'll be like, but honestly, I feel I'm okay. I'm not diureting. I'm not having any. Let me walk away.
What has
but yet you're a time bomb.
Escape, from the
yes, yet you're a time bomb. It's a matter of time. The incubation period is still going on in the system. So we need a lot of counseling, a lot of sensitization. Let people know how this disease operates in the body system. That yes, in these 2 to 21 days, you might be very normal, no issue, you blow up once. It's a time bomb. So we need these things to be addressed.
Yes. I hope the Ministry of Health, can take note of some of these, issues or concerns that you have raised. Mr. Musa, I would like to get your final remarks.
Yeah, thank you so much. First, I must salute all medical interns, the medical doctors, the intern pharmacists, the nurses, midwives, and dental surgeons, as well as pharmacists. So, because when you go to most of our regional hospitals, and these are the internship sites, the first responders that you'll deal with are the medical interns. And many times you'll see only these as you come into the hospital, say only these are the get out of the hospital. So these are your doctors. So we must salute them wherever they are. Especially now the team that is in Museveni. Yeah. They tried their best in the beginning. Some of them got exposed. Some of them now are isolating, but they've not run away. Like you had some person ran away from isolation center.
Yes.
The case that has been found now in Masaka. Yeah, was in isolation center but ran away. But our colleagues have not run away from the front line. So we must salute them for that. And I'm happy that the president has come out to make a presidential address on this and has pledged support to health workers, including the Minister of Health and everyone else. And in the team, if you watched, you saw that the whole leadership of Minister of Health was was present in the building. And lastly,
yes.
Lastly, let us do the right thing urgently. Let's not wait for us to have this blown up.
Yes.
Let's do this urgently as a country, ensuring that whoever is concerned, the multi-sectoral approach I talked about, is involved in this. Let Minister of Health get there is the necessary resources. Let us not hear Minister of Health is asking this and Minister of Finance is not providing, or Parliament is taking time to sit, or Minister of Water is not providing the facility with running water, or there's no electricity, or there's no what or what. Let everyone do the right thing at the moment to save Ugandans from this outbreak.
Well, thank you so much, gentlemen, for joining us this morning. I've been joined by two gentlemen, one Mr. Samuel Olede, who is the president of the Uganda Medical Association, as well as Dr. Musa Lumumba, the president of Federation for Uganda Medical Interns. I hope I have mentioned that right. And they've been tackling the issue in regard to managing the Ebola outbreak in Uganda. That is all we had for you on this segment. Keep watching Sunrise at Sea and don't blink.